fertility control, and anti-contraception is a method or device used to prevent pregnancy. Today I will be discussing types of birth control, as well as what they are and their effectiveness. Lastly, the benefits and alternate uses. Not enough girls know how to prevent themselves from unwanted pregnancy. One way to prevent unwanted pregnancy is to be knowledgeable about birth control and utilizing it if possible. Today I will be discussing 7 kinds of birth control. Aside from the obvious abstinence, withholding from sexual activity, and condoms, the first option for birth control is the contraceptive pill. The contraceptive pill is given once a day, and there's a pill for every month. On the last week, a placebo pill is given, and that allows for the withdrawal, bleeding, and the menstrual cycle to happen. The pill is 91% effective. Second is the birth control patch. The birth control patch is stuck to the arm, back, shoulder, hip, or buttock of the patient. It's left on for a week and changed once a week. The third week is left off to allow for the menstrual cycle. The patch is 91% effective. Third, we have the vaginal ring. The vaginal ring is a silicone ring inserted into the vagina by the patient. It's a hormonal form of birth control, which means it uses hormones to prevent ovulation and increase cervical mucus to not allow for sperm to enter and fertilize. The vaginal ring is left in for 3 weeks, taken out on the 4th week to allow for the menstrual cycle. The vaginal ring is 91% effective. Fourth, we have the Depo shot. The Depo shot is a hormonal injection given once every 3 months into the buttocks of the patient. Due to the doctoral need of receiving the shot, this form of birth control is more effective. It's 94% more than the previous ones I've talked about, because there is less room for patient error. The fifth form that I want to talk about is the Nexplanon implant. The implant is a mini hormonal rod that is surgically implanted in the inner arm of the patient. It allows for 5-year protection and is 99% effective. This is even more effective than the Depo shot because it stays in longer and it doesn't allow for any patient error because you can't take it out by yourself. Sixth, we have the IUD. IUD stands for intrauterine device. The IUD is a T-shaped device placed into the uterus of the patient. There are 2 kinds. The first kind, which is pictured here, is a hormonal. It does the same thing as other hormonal, so it increases cervical mucus, which discourages sperm to enter, and it the second form is the copper, which just makes the womb inhabitable for sperm and embryos. It is 99% effective. Lastly, the tubal ligation is a permanent surgery performed by a physician where the fallopian tubes are tied, cut, or burnt in order to prevent fertilization from happening. Basically, the egg cannot travel into the uterus to be fertilized, thus pregnancy cannot take place. On top of preventing unwanted pregnancy, birth control has other benefits. First, you're able to skip periods. If you skip your placebo pills in the oral contraceptive and just start, you won't have a menstrual cycle. Same with the ring, you don't skip your week. Same with the patch, you don't skip your week. It all can skip your period. Birth control gives you shorter and easier periods. This means less cramps. They do not last as long. They enlarge breasts, less headaches, milder PMS symptoms, and lighter periods, which everybody will enjoy. Birth control was most used in the 20th century, and it helps prevent pregnancy when used correctly. So if the pill isn't taken at the same time every day, it's not going to prevent pregnancy. And same with the patch. If you don't put it on at the same time, not going to prevent pregnancy. If you don't get the shot, not going to prevent pregnancy. So you have to really be committed. And lastly, birth control does not prevent STDs. Birth control should be used with condoms so that STDs cannot take place. In conclusion, I think it's important to know of the forms of birth control because of the culture these days, and women should know how to protect themselves.